Hello, I'm Dr. Geoffrey, ER physician, crisis and split-second decision expert. Did you know that Halloween was the most dangerous 24 hours of the year for children? Halloween is the most dangerous night of the year for children. Hello, join me. We're going to go over some Halloween tips for COVID especially. But let's talk about the pre-COVID. We all know that Halloween, as I just said, is the most dangerous night of the year. This year, there will be over 41 million children trick-or-treating. The number of deaths on Halloween are twice as bad as any other day, meaning that your child is 2 times more likely to die during that 24 hours of Halloween. We have to be on guard. Now you add COVID in there, and COVID presents its own set of challenges. But what we already know about past Halloweens, we kind of know about being visible and making sure that parents escort children, making sure that they have on reflectors. But now we're going to talk about COVID. Trick-or-treating during COVID is different as well. Let me set it up. In this period, we know we have got the Delta variant of COVID, which is about 250% more contagious. It replicates about 1,000 times faster. What that means to us during Halloween is our mask means something different. Our mask means something different. In other words, making sure our children have on a double layer mask is absolutely key and essential because it decreases the spread. It decreases the spread. Now there's some rules. 9 rules that you can make Halloween, even during COVID, as safest as possible. Number 1, make sure your child wears a mask. Number 2, if your child is unvaccinated, they should probably only trick-or-treat with members of the same household. Number 3, trick-or-treat in small groups. Yeah, not this year. Those large groups, trick-or-treat in small groups. Vaccinated people should trick-or-treat in small groups. Adults should accompany children. But here's the COVID piece. The adults should be required to wear a mask. And if possible, require adults who are accompanying children to be vaccinated. What we already know based on previous years is that 70% of children will be unaccompanied. This is your parents. Jump on in there. Accompany your children, even your teenagers. Next one. Hand sanitizer. Your children should constantly use hand sanitizer the whole time while trick-or-treating. And for those families who are going to participate in Halloween, in terms of giving out candies, let's do it differently. Number 6, if you're giving out candy, maybe you should consider setting out a stand or a station further away from your home or just outside of your home. That way kids don't have to gather. Kids don't have to gather in these groups because we know the COVID Delta variant is more contagious. Number 7, maybe you should prepare goodie bags. Instead of having a communal bag where we all just kind of reach in there, have prepared little bags where you can spread them out and people can just come by and grab one bag. Decreases contamination. It decreases large groups. I get it. It's been shown that the COVID variant, it doesn't spread from contact. But just keep in mind, we still have the regular viruses that we've had previous to COVID. Rhinoviruses, the flu, and those spread from contact as well as respiratory. Again, consider preparing goodie bags instead of using a communal bowl. And the next one, if you're going to prepare goodie bags, wash your hands beforehand. Wash your hands beforehand. And finally, parents and others who are giving out candy, we ask you to wear a mask as well. We ask you to wear a mask. And I'm not only coming to you as an ER doctor, but I'm a father as well. I'm also an ER doctor who's worked many Halloween days. As I started off saying, Halloween is the most dangerous 24-hour period for children. You notice I just didn't limit it to Halloween night. Work in the ER and the stats. For some reason, every single Halloween morning day that I work, it's been a motor vehicle crash involving a child. What we do know is that of those children who will be unfortunately hit or killed on Halloween night, 70% of them will involve a driver who's been drinking. Yes, a driver who's been drinking. So drivers, if you have children or not, if you could just do us parents a favor, agree now that on Halloween, you just won't drink. Okay, maybe that's too much. You won't drink and drive. That includes driving buzz. That includes having just one drink. If you have any alcohol in you, and I'm pleading with you, during that 24-hour period of Halloween, where it's most unsafe for all children in this country, even my own, we ask you, please do not drink and drive on that night. The decisions that we make for our children and for ourselves can save our child's life. It can save another child's life. Look, we want to enjoy Halloween, but there's some nuances, especially as it relates to COVID. So let me summarize a few of the big points. Wear a mask. Make the mask a part of the costume. The costume mask, the typical costume mask, is not good enough. Do something different. Wear a double layer mask and maybe decorate that mask. Make sure unvaccinated kids do not trick or treat with vaccinated kids. It's dangerous. Next one, trick or treat in small groups. Stop the large groups during COVID, small groups, and those should be vaccinated small groups. Finally, parents, escort our children. We know that 70% of children in the past did not have a parent with them. Consider going, parents, and make sure you're vaccinated and make sure you wear a mask. Use hand sanitizer the whole time. Parents of those, families that are giving out trick or treats, make sure that you wear a mask. And consider setting up goodie bags. Instead of having a communal bowl, consider setting up goodie bags. Consider putting a stand out in front of your house. And if you could stay 6 feet distance away, that would be a nice as well. We're in this together. Dr. Fauci said it should be reasonably safe for children to trick or treat and enjoy it. We want you to trick or treat and enjoy it. Do it as safely as possible. Look, if you found this video helpful, hit the subscribe button and join me on my next video.